Yeah,
Okay,
you would like, yeah, let's go.
yeah, let me pull this up and then we'll get started. I'll let people come in and it'll be a second. It always waits. It seems like it's a little bit before people get in. Share the screen. Oops. Y'all see the?
We do.
Yeah. Okay. Hi, everyone that's joining us. We'll wait for everyone to get in and then we will start. Okay, it looks like we've still got a couple more people joining, so I'll just give it one more minute. As everyone hops on. Hopefully it's beautiful where you are. It certainly is beautiful in Houston today. So before we get to our panel, we wanted to go through what's going on in some of our local chapters. This is a multi-chapter event with Boston, Houston, Madison, New Jersey, and New York, and we're excited to have representation from across the country for this exciting healthcare panel. We have, each of our chapters have some great events coming up. I want to take you through some of that. Here are two events coming up towards the end of May and the beginning of June for Boston. You can register at amaboston.org/events. Virtual perfect pitch competition and the virtual marketing mingle. And then in Houston, we have our first in-person event since February 2020. And we're talking about the psychology of shopping and how you can use it in both B2B and B2C sales. We will have a mask policy and we will social distance, and the luncheon, you will actually get a to-go box on your way out. So we'll sit theater style to listen to the presentation. We look forward to seeing you guys there. In Madison, here's some upcoming events for Madison. The next one, May 25th, which is their virtual craft marketing. And then on June 17th, we're having a fun end of year happy hour outdoors. Hopefully it'll be a beautiful day. Bring your own chair and blanket, and then we'll provide the beverages and snacks. For New Jersey, here are a couple events coming up, and there's a QR code on the screen if you want to grab those now, if you want to register for mindfulness at work or a brave new day in marketing. And then for New York, join AMA New York for the Marketers Toolkit Workshop led by Robert Rose to learn how successful companies are structuring their teams and their processes to navigate today's multi-channel world by creating story packages successfully. And now I want to introduce Christine out of our New Jersey chapter, who's going to introduce our moderator for today.
Great, thank you so much, Heather. Today we have Mary Considine with us, who is actually the AMA New Jersey chapter's past president, immediately preceding our current president, Kendra Clark, who some of you from the New Jersey crew will know. Mary is both a CMO and a CDO at Ascenda Integrated Health. The D in that is development officer. So she's a busy woman. She's very active in the AMA, PRSA, the 4As, and she's working for her doctorate in business administration. So we're blessed to have her with us today. I want to turn it over to Mary and to the great panel. Thank you.
Hi, good afternoon, everybody. Thank you so much, Christine, for the introduction.
And we're excited to have a great conversation today. I think it's probably best for each of our panelists to introduce themselves so you can get to know them a little better. And let's start with Erica Martinez. Welcome, Erica.
Thank you. Really nice to be here and very nice to virtually see everyone. I'm Erica Martinez. I'm an SVP of brand strategy at BGB Group in New York. We are a healthcare communications agency working on communications, medical and promotional communications to both healthcare providers and patients and more broadly. I've been in the healthcare space for about a decade and in marketing my whole career, and really excited to have this conversation today with everyone.
Wonderful. Thank you so much, Erica. Devin, welcome to the panel.
Thank you, Mary. I'm honored to be sharing the virtual stage here with everyone, Erica and Stephen. I'm joining from Houston, Texas, representing HCA Healthcare brands in Texas, specifically the newly launched HCA Houston Healthcare brand. HCA Healthcare as an organization runs hospitals across the country as well as in the UK. And for myself, I've spent the greater part of about 2 decades in marketing communications, from Sara Lee in Chicago to Johnson & Johnson in New Jersey, even AT&T in Texas. So for me, I love talking about healthcare. I've had some experience there in pharma as well as provider space. And I think, like everyone else here, we've been adjusting with varying degrees of success in working from home. This has been something pretty interesting for our workforce as well as for individuals too. So looking forward to the conversation today, and thank you very much.
Thank you, Devin. Stephen, welcome.
Hey, everybody. It's great to be here. And thank you, Mary. And it's great to be with the other panelists today. I'm formerly the SVP Chief Brand Officer at Cigna, currently a board advisor for a company called Birch Tree. And previously, a bit like Devin, some non-linear career experience, including work in and out of the US with HSBC, JP Morgan, and American Express. And more on that later. But back to you. Anxious to get started here.
Great. Well, we have a lot to cover today. So I am going to start with you, Devin. I have a good question for you.
All right.
How has COVID-19 changed the conversation around healthcare? And what do you think are some of the new trends that have developed that are here to stay? What are your thoughts?
Well, as a provider organization, we're really thrilled that the conversation is going beyond simply personal wellness and fitness, which is, not to diminish that at all. It's very important. However, it's a little bit sad that it's taken a global pandemic to raise awareness among the general population about the importance of public health. Many of my friends and family have actually realized the seriousness of the pandemic in 2020 only after the NBA canceled the season. I don't know if anyone can remember back to March 2020 and the circus that was happening, but it seemed to be that point in time when the NBA season was canceled that I think for a lot of folks, that was a kind of a wake-up call. For us, I've noticed that there's this heightened interest in healthcare influencing how people are conducting business, sort of in completely unrelated areas. So, when you are thinking about, how you maybe go in and out of a restaurant, I mean, you've got QR codes for the menus now, you've got contactless payments, all of those technologies were around previously, but I think because of the heightened awareness around cleanliness and hygiene and keeping your patrons safe, you're actually seeing more of that, and for good reason, because it's easy to use, it's relatively inexpensive, and it actually helps reduce the transmission of the virus in public. So, are these trends that are going to continue? I think they will continue in some form that's appropriate for the time, but it's, simple things like that I see can make a difference, not just here, in the US, but globally, because of how utilitarian they are and how accessible they are.
Absolutely. Great, thank you. This is kind of something I'm going to throw out to everybody. How do you think successful healthcare brands have repositioned themselves to become more patient-centric and competitive? We all know, there's a big conversation around healthcare and things are rapidly changing. So, what are your thoughts? This is really something, each of you, if you'd like to answer.
Yeah, I can start. And I do have awareness that I seem to be having some internet issues. So if I freeze, I will get back on. I think, when we look in particular at the pharmaceutical space, but also at healthcare more broadly, we all talk about how the patient is the North Star. We've always been, centered on the patient and doing what's right for the patient. I think that the shift that we're really seeing right now is a move from what we would call patient centricity to experience centricity, and thinking more about the experiences that we need to deliver for patients so that they're able to actually really be in charge of their health and really take control of things. So this you've seen in everybody's desire to partner with Uber or Lyft to help get patients to the doctor, or in terms of solutions for delivering telemedicine. There's a lot that's happening there that I think has been very dynamic. And I don't think we're going to see that stop, because the experience is becoming so integral and so recognized.
Absolutely. Wonderful. All right, so, let's move to trust. As we're talking about patient-centered, experience-centered, obviously trust has a huge role to play. And Eric, I'm going to throw this one to you. What role does marketing play in building trust for patients and consumers now and both in the future?
It absolutely plays a role. And one thing that this group was talking about before we started the call was the Edelman Trust Barometer. And one of the things that we see there in 2021 is that people, patients, consumers are trusting companies more than they're trusting media or government or NGOs, which actually puts a lot of onus on companies to be able to make sure that they are helping to replenish the sense of information bankruptcy that has been out there. And that is done very much by listening to your customers, which you can do in social media. In the pharmaceutical space, you can do by actually listening to what doctors have to say about the experience with patients, and then reacting to it appropriately. Also really important is to deliver clear, concise information that's actually going to be actionable. People are able to see through the garbage, and they don't want to be lied to. They want to make sure that they're getting the truth and that they're getting a whole story. And so there's an increased responsibility to fill in some of those gaps. If we want to really empower patients, we have to make sure that they're starting on an equal playing field. And right now that playing field is not necessarily equal. And then the last thing to keep in mind is that talk is cheap. And if you're going to say that you're going to do something, you need to follow through on it.
That's wonderful and actually so important. We all know. Devin, you work for HCA Healthcare, which many of us know is a very large healthcare entity. And, in your role marketing there, what have you been doing to kind of build trust with your consumer and patient base?
So it's really interesting, but I'll go back to something Erica said about the Edelman Trust Barometer, that companies are having to take on more of this role because your own organization is seen as a higher trusted authority than the government, than the media, than other experts out in the public. And having actually worked at Edelman in the past, I've got an inside track on sort of how that trust has grown over time. And one of the things that's interesting, if you look at marketing as sort of a continuum of you're paid and you're earned, trust can actually be increased and can build when you use all of that together. And I think intrinsically we all know that when you have an integrated message and all that. But some of the Edelman research actually says that people trust people like me. They trust the subject matter experts over the CEOs. They trust those folks who are considered experts in their field. And so for organizations, and then, I can't necessarily speak that HCA does this yet, and but other organizations are doing a good job of putting the experts, the subject matter experts out there, and making sure that those are the voices that are heard, because I think, as we've all experienced over the past year, you have people talking about things that they might not have expertise in, that tend to really distort the story, the information, the critical public health information that's out there.
Absolutely. And we certainly can't talk about trust and healthcare without bringing up data. So Stephen, I have a question for you. How can marketers build trust and reassure consumers that their data is going to be kept safe?
Yeah, and thanks for that question. And just playing on what we've talked about just in this discussion right now, the thing that comes to my mind, it's really beginning with transparency. I mean, all of us as marketers are involved with marketing, know that, you know, with the changes that are happening with first party data and the cookieless future, transparency is going to be even more important. So from my perspective, it's about partnering within our respective, your respective organization, really to have that triumvirate of privacy, compliance, marketing, sales, so that people are not just aware of how do we get to market, but how can we be transparent? And then something that was brought up in terms of experience, what are those touch points that are going to be most critical for customers and patients? Do we know, especially given the shift in terms of how people are engaging now, is there a need to go back and reevaluate the most important and critical touch points? So from my perspective, I think there's things to keep in mind around transparency, how we're putting it out there, which touch points are used. And then the other thing that gets me really excited about where we're going next as a society is, in my personal experience, I've never seen a time when more people have been proactively engaged in their health, because so often it's let me wait until I'm sick and then suddenly I'm going to be engaging in my health. And now suddenly there's this wave of people trying to get ahead of the curve as vaccinations occur, as they understand where they are on that journey of care. So.
Absolutely. Erica, what are your thoughts about, how marketers can reassure consumers that their data is going to be safe with us?
I think they have to put the systems in place to make sure that the data are safe. I was reading yesterday about a situation in Finland where a major mental health provider had their information hacked, and everything kind of went all over the place, and people started getting Bitcoin attacks and whatnot, and the system should have been safe, and everybody thought the system was going to be safe. And in thinking about that, again, some of the feedback that we're seeing in the media about the new Apple update and how people who install the update are actually less likely to turn off ad tracking so far. It's not so much that people don't want to have the data used properly, they do want to make sure it's safe. And so it really is about figuring out the mechanisms to do that. And I don't know that anybody has quite nailed that yet, because there are too many holes that people can get through.
Absolutely. We have some good questions here. So one just came in, and the question is, it's a good one, is data ever safe? And is blockchain the answer, maybe? Anyone have some thoughts on that?
It's interesting, but yeah, there are applications, I think, for blockchain across the health ecosystem. Again, as a provider organization, we operate under the HIPAA structure, the Health Insurance Portability and Accountability Act, where patient data and personal information is protected. Really protected, so that, just this very thing doesn't happen and it doesn't leak out. And when it does, it's not the complete information. So could blockchain help that? Absolutely. It's a matter of how you implement it and how people can get used to it. I think for anyone who's spent any time in healthcare, having technology change is a massive undertaking, because you're dealing with people and how they use and access their information and patient information that they have been doing in a certain way for probably decades. So it's a people change in addition to a technology change.
Absolutely.
If
We have
I can
another, oh, no, go
Well,
on.
I was just going to see if I could build on that really quickly. I think one of the things when we think about the patient experience or the consumer experience, and we think about data, Devin makes a really good point that it's hard to change data systems, whoever we are. And one thing that we see is that everybody wants an app, everybody wants a tool, everybody wants a something. And I think that a lot of marketers have even experienced an obligation that they have to make an app because somebody thinks that they need to in order to be doing their job. The problem is that that's not necessarily what we really want as people. I mean, think about, we talk about this, think about how many apps you have on your phone, how many of them do you really use? When we're thinking about managing your health, do you really want to have a lot of different apps, or do you want to have one that is able to keep everything together? And who's going to take on solving that? As it is, if you are in a major city and you go to doctors who are part of different hospital systems, they may be using different electronic health records, and then you've got a different app for each one on your phone. So when you go to the doctor, if you need to look up test results, you've got to say, okay, wait a second, which one is this in, so that you can pull it up, and the systems don't necessarily talk to each other. So we're not really as a whole creating the best experience right now. And part of the way that we will get there if we do unify these things is by ensuring that the data is protected.
Absolutely. Before we leave the trust area and moved on to digital transformation, there's a question here I'm going to pose to Stephen. I think we all talked about this when at the initial panel. Many in the country right now seem to be distrusting experts and are more inclined to trust non-experts. And this seems to conflict with some of the findings. What are your thoughts on this, and how can marketing overcome the challenge of, many really looking to non-experts to get some healthcare information today?
Well, from my perspective, I think it's something that we touched on around, yes, there's a look for information and making sure that information is actually available at different places and different touch points to reinforce the validity and where did the information actually come from. It's a tough thing though, because one of the things that comes to mind is it better for certain companies to even go broader with a message around, this is what it is and how it works and how you can access, versus a one-on-one messaging just to an individual customer. But I think there's a lot of work to do to build trust in terms of where information is coming from and how you can verify that what you're receiving is indeed the valid information.
Great. Wonderful. So,
One more, I guess, other area of trust that I did want to throw out there, because it's something that, again, as a healthcare industry, we have to find a way to help solve this. But it's the idea of the gap in trust among communities of color and tribal nations that we're seeing it come to light starkly as we roll out vaccinations across the country. And this is something that's deep-seated and ingrained and has been, sadly part of the history here in the U.S. That we're really, again, as a provider organization, we're starting to see that, face-to-face in the communities where we operate and where we serve. And so, is marketing the answer? Not entirely, but I think it can certainly help. And I think, having more diverse people involved in this solution and having people who are able to communicate effectively with these different organizations and different communities is certainly a start to that.
Absolutely. And, as we kind of move on, we're going to kind of focus on digital transformation in this next segment. Keep the questions coming. Some of the questions we'll be kind of asking in between, but we're going to have plenty of time for Q&A at the end. So I'm kind of pinning some of these questions and we'll definitely get to them. So I don't want you to think we're not going to get to your question. So this is for all of you. It's a question. What are the top healthcare digital trends that you see having a big impact in 2021? Erica, you first. What do you think?
Telehealth, and telehealth. There's no question that is going to continue to be important. And the conversation increasingly is starting to really address the opportunities and the risks associated with it, because we know that not everybody has access. What does this mean for people who are in places where there isn't good cell service, there isn't good Wi-Fi? What does it mean for people who don't have access to a computer? We often think everybody has a cell phone. Not everybody has a cell phone. Not everybody knows how to use it. So this is something that is going to continue to be important. I think that we're also, I mentioned before, everybody wants to partner with Uber. I think that the idea of how we take a piece of technology and partner it with a service in order to deliver something to patients is going to be important. And at CES, we saw a couple of connected apps. And this is another space where there will continue to be innovation because people need it. One of them is a heart monitor that actually it's prescribed by the doctor and is able to provide monitoring that goes into a data hub that feeds into the EHR so that the doctor can monitor the patient. There are a lot of different therapeutic areas where we could see a real benefit for that kind of technology, especially as we get more comfortable with on-body devices and sort of keeping our technology with us all the time. We're not quite at the moment of singularity yet, but we're getting pretty close in terms of what we carry with us. And so I think that is going to continue to be something that we see evolving.
Great. Stephen, what do you think? What are your top digital trends?
Well, I think it goes without saying, telehealth definitely here to stay. And then I think the way I break it apart in my mind, it's all about the right connectivity, the right proximity, and the right frequency. So there's a mix of different ways that one can engage with patients and really to both understand care, find care, and if not care, engage with the medical community. So again, I think about its connectivity, where you want to be, how you want to engage. Sometimes that's telehealth. Sometimes it's going to be face-to-face. And how does that happen? I think about my elderly parents. I mean, it was beyond them to go online and program vaccines. I mean, in their 80s. But luckily they live somewhere where the health system did the outreach to them. So again, there are different ways that this can take place. And then in proximity, I think about, helping to understand, what are the options closest to me? And sometimes that could be telehealth versus actually going to a physical location. And then the frequency, when you think about digital transformation, I tend to think about right sizing the frequency and not overloading consumers so that the message falls on flat ears or eyes. And so I think that's the other, I call it work to be done as these new technologies and new ways of engagement start to roll out at scale.
Great answer. Absolutely. A lot to think about. Devin, how about you? Top healthcare digital trends that are going to make an impact this year?
So I think everything that Erica and Stephen have covered are particularly pertinent and really encapsulate, how the industry is approaching this. An area that, we're looking at, and again, sort of as a provider organization, is also how do we, as we're taking care of patients, keep those patients' families and caretakers informed of what's happening. So it is all about, the data, the proximity, the ability, the location of all how that happens. But it's also something how that actually comes together so that, myself as a caretaker to my elderly parents know what's happening, maybe even from, across the country. And I have the ability to interact and intercede when necessary about their care and being able to do that in a relatively transparent way.
Absolutely. We have a good audience question here. So pose this to the panel. With so many sources for getting treatments, vaccines, tests, etc., and availability as a primary concern for many patients, how do you focus digital marketing and onboarding to capture patients and keep journeys positive when everyone wants just-in-time visits and fast results without 20 different provider apps for their records and interactions? So a lot of what you mentioned, Erica, about going on your phone, having multiple apps. I mean, how do you create positive patient journeys and really, benefit your healthcare provider or, whoever you're working for, whatever brand, in this environment?
I think that just like a lot of the feedback in the course of the pandemic has been, we don't necessarily want to go back to normal because normal wasn't necessarily working. I think that there are some ways in which the normal approaches that we've taken to marketing are not necessarily working, and we're going to have to explore some things that we weren't necessarily quite as comfortable with before. Again, if we go back to this idea of the patient being the North Star, every brand is trying to make sure that doctors prescribe their product and that patients are showing up and asking for their product. But what if we actually thought about it differently? Is there a world in which a number of different brands could come together and say, for example, this is why you need to be adherent to your therapy, regardless of what you're taking, this is what you need to do. And we all are in this market together and really want to focus on you so that whichever brand you're using, you know that we've got your best interests at heart. This is not the way we normally approach things unless we're doing it with advocacy. But what if we took a step and figured out how to do that from a branded perspective? Lots of regulatory things to work through and whatnot, but that's a kind of area that we might be able to think through. Also, other kinds of partnerships. Can you actually, as a marketer, think of a different way to intersect with the other agencies that are working on a particular piece of business? If one person really owns the patient side and another person owns the provider side, or one agency and another agency, is there a different model for the agencies to work together to ensure that the story is coming through more effectively? We all try and do it, and I think we're all very committed to doing it, but are there some ways that we need to try and work different in order to be better at it? Because the truth is, the experience that we've got out there for patients is not consistently great. And it's not necessarily the fault of any one marketer. It's kind of everything coming together in the nature of our health system. So it's about being a little bit uncomfortable, I think, and trying some new things and seeing what works. And with that, we may be able to make some really big differences.
Great. And along those lines, Stephen, how has the digital transformation in the healthcare industry helped brands to deliver better service and a better patient experience?
Yeah, I think from my perspective, there's been a lot of continued, right information or not better information at better times versus right, because right depends on the situation. But I think that's been one of the evolutions and the accessibility of information to a broader subsegment of the population. I still think there's so much to do here, though, because I think the multicultural aspect that Devin brought up, and in my own career, one of the things we found most effective to help build that trust was finding the right influencers who were closer to the target audience to try to help us get the message out. Because who do you trust? Do you trust this big company that you're not that familiar with, or do you trust somebody that you see on a regular basis? And so I bring that up as there are different tactics and ways that we as marketers can figure out the right way to breach, I call it, the information divide digitally. And I know I saw a question there about platforms. And again, I think it's who you're trying to reach determines which platform you're going to use, because each one has slight pluses in terms of who's tuning in to that particular platform. So that's kind of how I frame it up and think about it.
And as we kind of move, into talking more about engagement, and we're going to talk about consumer engagement. We're also going to talk about employee engagement to some extent. Erica, what do you think the role of technology? What is the role of technology in healthcare consumer engagement? I mean, we've talked about apps, but what else is technology? How else is technology broadening the consumer experience?
I think there are a lot of different things. There's the actual communication experience, as we're looking and we're receiving communications, for example, on Facebook. I looked at my Facebook feed this morning and I had several different ads for different kinds of vitamins from different companies. And honestly, I was looking at it really critically and was having a little bit of a hard time distinguishing what the difference was between them. So, making sure that as we are looking at those channels and figuring out what communications we're putting in them, that we use them to the best of our abilities. But certainly also how and where the digital experience in terms of the telehealth delivery is changing. For example, there's a company called MindBloom, which delivers ketamine-assisted therapy. So definitely an interesting area to be talking about in general, but one that is increasingly in focus as people are challenged with coming up with solutions for their mental health issues. They didn't want people coming into the clinic during COVID because people weren't comfortable doing so. So they came up with a way to do this therapy at home. So it's a combination of drug and therapy that is done at home under the guidance of the psychiatrist. And ultimately, we don't know exactly how it's going to work out, but it's been very successful for them to date. Other things we talked a little bit about on-body devices, but I think the other thing that's really important to remember is that there is less of a divide between health and culture than people, I think, believed in the past. And, we've heard different people talk about, coming together at the intersection of health and culture. Health and culture are intrinsically linked, and we really understand that now. So when you look at other things that are actually relating to food, for example, or exercise, a lot of people bought exercise devices and brought them into their home. That's a way that technology is creating consumer health engagement that was not necessarily as overtly thought about before. So there are going to be many different ways that these tools are making their way into our lives that are going to have a health benefit and health impact.
That's awesome. Thank you. Devin, definitely a question to you around employee engagement. I think we've all seen how that has changed and transformed, particularly when a lot of us moved to a work from home. We were really talking more about employee communications and engagement, but it's really vital in healthcare. And how can, marketing play a key role in employee engagement today?
I mean, that's a great question, and I think it's something that's applicable to everyone on this call. I mean, we're an organization that runs hospitals, and so our employees didn't have the chance to work from home. They had to show up. They had to continue to work, quote unquote, in the office when it was really the hospital halls and the operating rooms and the ERs across the country. And so for us, as a marketing organization, we actually turned our gaze inward. We operate here in Houston, Texas. As an example, the market here is probably the most competitive healthcare market in the country. 6 major systems, the largest medical center in the world, plus, a pretty good smattering of Walmarts and Walgreens and CVS's, all with clinics in them. Probably over 200 or so freestanding emergency rooms and urgent care centers around the city too. So people have options for getting care. And what we ended up doing is actually taking all of our marketing out of the market, pulling it all down as soon as the pandemic hit in March. And we turned our gaze inward and really partnered up with the HR team to build up our employee base, because once we got going in this pandemic, our clinicians were working 24, 36, 48-hour shifts. As the waves of patients came in, it was getting bad in terms of mental health and where people were feeling burnout and where they were not feeling like they were ready to come back into work again. And so we were working overtime to really produce important communications and materials around mental health, working with our behavioral health team in the hospital system itself to provide them the information to resources and benefits that could help them get through this and that could help their families get through this. And it's really interesting. It's a little bit of a silver lining in this pandemic that we were able to, put these processes and make these connections with groups within our own organization that we may never well have kind of worked with before, or at least to that extent. And so now we've got these processes and we've got these procedures and we know the teams, and we're putting more together, and we're really, hadn't focused on internal communications to this extent before. And now I think we've got a really sharp organization here internally that we can turn on at a moment's notice to really get our employees engaged and get them, in this case, the help that they needed quickly and effectively.
Absolutely. I think, particularly where I am too, we saw this increased need for employee engagement, and the amount of content that we're creating for employees has really shifted. And I think that is here to stay. And again, I agree with you. That's kind of a silver lining. We can care better for our employees, not just in crisis, but certainly as we move forward. And I think that will create a better workforce altogether. So we have a couple other questions here. I've got a really great question for you. Healthcare providers, it's an interesting one. Healthcare providers took a bit of a hit as patients postponed elective procedures, screenings, and checkups. The efforts to get people back in the door are understandable, but many ads and emails urging people to return for care come across as desperation by the provider. How does a healthcare provider avoid looking like their main concern is their own bottom line? Devin, you want to tackle this one?
I'll let Erica and Stephen take the first shot.
It's interesting. I think that with some different, it depends. There are a lot of variables, right? And some healthcare providers did not go to school to be marketers. They went to go and be doctors or dentists or whatever kind of healthcare provider they wanted to be. And the nature of things is that they've had to learn how to market. And something that brands can actually do for their healthcare providers that they have relationships with, if they want to, is provide some marketing toolkits. I have seen some companies do this. It can be very effective. It makes a shift in the mindset that says, I am not just, marketing my product to you because you're a prescriber, but I'm also marketing it to you because I understand that you are effectively a small business owner that needs to support your business. And those tips and tricks can be useful. But there's always going to be, it's practice and learning how to do it and training. And it's not something that people necessarily want to do. Again, this is not why they got into healthcare. They got into healthcare to provide health to their patients. The other thing is, this goes back to the idea of, what we could do either from a nonprofit advocacy perspective or something else. There were some big companies that actually did some unbranded work late-ish last year that said it's important to keep going to the doctor. It's important to stay adherent to your therapy. And so sometimes when those messages come from pharma as opposed to from the doctor, it can be received better because it doesn't feel like I need you to come to my office. It feels like I need you to be taking the best care of yourself that you can.
Yeah, and I would just add, Erica, I think it's the consortium of all the different brands and companies that touch the patient and the customer, from the payers to the physician, hospital networks to whoever it is. It's in the interest of society and everyone that people get in for the right care. And we're all seeing the articles about, upticks in cancer diagnosis because things were missed during the past year. So I think there's an underlying, like you said, there's a reason people want to get people back in for care, but perhaps the way that's being communicated, there's a great opportunity there.
Mm-hmm. Absolutely. I feel like I want to ask Andrew, who asked the question, like particular ads that he's seeing, so we can all kind of have a what not to do, because it is not translated well to the consumer.
Well, fear doesn't work. I mean, I think all of us can tell you that one as marketers. The fear message doesn't work. If people turn it off. So
yeah.
Here's another question along the same lines. How do you make marketing positive for issues like heart attacks or emergencies, which can seem negative, scary, and the marketing can be delicate? You don't want to scare a patient into coming into the healthcare system, but you want to inform them that these issues are serious without using smiling faces in your creative.
Exactly. Don't use smiling faces in your creative too much. We do a lot of patient research, and one of the things that we are hearing more and more is stop sugarcoating everything for me. Stop telling me that everything is going to be great, especially if they've got chronic illnesses or things that ultimately will be fatal. Don't give me the promise of, the smiling day on the beach, because that's not what I'm dealing with right now. Be honest with me. And that's something that is not necessarily in in the way that we're used to communicating about these things, because we want to be able to deliver the upside. We want to be able to talk about it, but patients are seeing through it, especially those that have been dealing with their health issues for a long time. So it is a fine line about balance of honesty. I think that some of the patient storytelling that you're seeing right now gets at that. But again, in a highly regulated environment, it can be difficult because everybody needs to monitor what the patient is saying, and you don't want to go too far into the negative, but you do want to go into the positive. So is there a way for marketers to encourage patients to talk to each other? Is there some way that we can take it outside of the traditional channels so that the information is being shared and people really are getting the support that they want? Some patients are even leery of going to advocacy groups right now because they know that advocacy is funded by pharma and they feel like it's going to influence the decisions and the opinions that they see there. So it's very, very tricky. But being straight with people is very important.
Absolutely. Here's another question for everyone. So we have all seen, great health disparities. I mean, became very visible during the pandemic. What can we do as marketers to help adequately, address the issues and help to overcome some of these issues within our healthcare system?
So, this is an area that I think does deserve to be addressed. And it gets back to some of the earlier points we touched on of transparency, authenticity, coming forward, as human and reaching out to folks who, reaching out to them on a human level, not talking down to these different communities. And providing them with the information that's well sourced, well researched, and that can help improve their outcomes and help impact their lives and their families' lives. It's something that, I think it's an entire ecosystem or industry thing that we do need to work together on.
Absolutely. And, speaking along those terms, we can talk about, outcomes-based care, which is care that actually helps people get healthier. Stephen, do you want to speak a little bit of possibly how as marketers, we can help with that to make sure people are actually getting better and we're not just, giving lip service to healthcare?
Well, I think one of the things that comes to mind, there's a continued education effort that I've seen in my own career, just around getting people to know the basics and really understanding the very basic rudimentary things about their own selves and their own health. And that falls into the prevention space. When preventive visits are covered by all insurance plans, and I think pretty much that's almost 100%, it's shocking the number of people who don't go. So they don't know. So I think one of the things is just going to be, it goes to some of the things that we've been talking about. It just, the frequency of messaging of not just when you're ill, not just when you're sick. Of course, you have to find the best care, but it's also about preparing yourself and educating, the patient around, knowing yourself. And so I think that there's still tremendous work to do there on all fronts. That crosses, all types of individuals, all areas of our country, and indeed, it's everywhere in the world. So increasing engagement and finding creative and innovative ways to help people understand the impact of engaging in their health. And we mentioned some of them. Everybody who gets some type of device and starts to pay attention. Everybody who's just a little bit further along on the continuum. As we nudge them and help nudge the process, I think is going to be better off.
Absolutely. We have another question here. While the patient experience is critical for creating, it's an interesting one, for creating a positive experience, creating trust and building brand loyalty, what can marketers do to affect change in siloed organizations where the patient experience is viewed as being within the purview of operations? Interesting question. I think a lot of us can relate to this question. So, who wants to start on that one? Good question. Thanks, Andrew. It's another question from Andrew. Good questions.
I mean, I'll start. I mean, I think it starts with being able to align around common goals and what are you trying to achieve? I mean, the way silos get broken down is reaching across and figuring out what are we trying to achieve here in terms of the experience. So that's a first step. Not easy to do because there could be different objectives that each silo is trying to achieve, but landing with the right data and the right information about where patients are trying to get to and how each of us impacts that path is the way to start from my perspective. And I'll pass it to Erica and Devin.
So it was funny, I was actually trying to talk on mute, but yes, I agree. There is a common goal that that needs to be communicated and shared. And I would also say, having worked in large organizations where we put together consumer experience teams, now patient experience teams, it has to be a big tent. It has to be an inclusive tent that doesn't necessarily turn individual departments away or anything like that. Speaking about what we're doing, at HCA Healthcare, it's an organization that for the patient experience includes clinicians, includes IT, includes HR, includes marketing, includes operations, includes food service. I mean, it spans every department almost, and there's representation there from every department because it's that important. And in reality, it touches all those departments. And so, it goes back, Stephen, to what you said. What is that common goal, and how do we do the hard work of interacting with each other and sort of, how do we get there on that path? And it takes time and it takes resources to do that.
Well, and a lot of times, I mean, the marketing organization, I mean, we're all marketers. A lot of times the marketing organization is the one who's sitting and can see across the silos and can help be the convener within the organization. Not easy to do. And sometimes that requires a lot of repeated conversations, but that's part of, I think, how you move it forward. And it's not going to be solved in a day, but if you can keep moving it forward and making it more positive, then you're making progress.
Yeah, I think the other thing to remember is that when we talk about a patient experience or even a doctor experience, we often are focusing on it from the perspective of their experience with a disease or their experience treating a patient with that disease, but there also is their experience with the healthcare system more broadly, which I think is part of what this question was actually about, and the experience of the doctor as a member of a healthcare system. What are the experiences that they are having that impact the decisions that they're making that are not as specific to the disease journey itself, and understanding what and where you can influence those pain points is also important, but also very difficult, because then the problem starts to get bigger, but they are inextricably linked.
Absolutely. Thank you. We have another question here. This is definitely very on the tech side. What is your opinion of ShareFile? Which is more secure, ShareFile or blockchain?
I mean, I don't know. I'm not going to profess an opinion on either of them.
No.
Same here. No.
All right.
Dig more into that one to find out.
Here's a question. This has actually come in through the chat. It was a question we had talked about addressing, and then someone texted me and asked if I would ask it. So we do know that there are a lot of people that want to transition into a healthcare marketing career. What are the competencies and the skills? What is your advice to someone who has healthcare marketing experience? We have somebody in the chat who has been out of the industry for a few years. How did they transition back? And this is really for the three of you, because you're all kind of from different spaces within the healthcare marketing industry. What is your advice for someone looking to transition? And how do you how do they build? How do they make that happen and get the job within this industry? Erica, what are your thoughts on that?
I think it's great that there is a lot of interest because this is a category that's only going to grow, and we need really great thinkers and really great marketers. So we definitely are excited to have people. I think it's important to remember that you are going to be working in a regulated environment. And so some of the things, you just have to be realistic and honest about that. But that doesn't mean that there's not a lot of room for creativity, and it doesn't mean that there's not a lot of room for solutions. And I think that that's one of the stereotypes that exists about healthcare marketing, pharmaceutical marketing, that it's not going to be fun. You're in the business of helping patients. You're in the business of helping people take care of their health. And if you are somebody who is interested in that and really feels strongly about it and really feels strongly about helping to make that possible, there is a place for you. You don't need to know every bit of nuance about all of the science. A lot of that can be learned. It's a lot easier to teach a marketer about pharma than it is to teach somebody who is a pharma person about marketing, is one of the things that that they like to say. And it's true, it's definitely something that can be learned. And if you think again about some of the things that we've been talking about today, and the opportunities to make unexpected connections and the opportunities to kind of go outside of the normal zones, there really is a lot of opportunity and a lot of welcoming that we can do. So tap into your network, see who you can talk to. Obviously, if you can find a mentor who's in the space, that's going to be very beneficial. But it is a welcome and growing field that is only going to get more interesting.
Wonderful. Devin or Stephen, do you have anything to add to that?
I mean,
Go ahead.
Go ahead. Well, I was just going to say, we're all three of us on this panel, and yourself as well, Mary, are examples of folks who have come in and out of healthcare. I mean, I 20 years ago was at Johnson & Johnson and left the healthcare space and then got back in. So it is possible, and it is, marketing, communications are transferable skills.
That's
and
right.
when you keep the audience in mind, you can market anything. And Erica made a great point. You're helping people get better. You're saving lives. There is a mission in healthcare, and it really does strike a chord with a lot of people. So for those interested in getting in the industry, it's a big tent. Come on in. We need the big thinkers and the big ideas and the creative folks, and we absolutely need that.
Yeah, and I would just add, go to any of the large, any of the healthcare related companies, whether it's pharma, the insurance, the health hospital systems, and you'll find that those marketing roles are everything from internal agency to B2B specialists to data and lead gen. And so literally every single function is repeated in the healthcare space, and it's a growing industry. So lots of opportunities. And I couldn't agree more. I think there's lots of room under the tent.
Absolutely. I know myself, I always love to bring somebody in from outside the industry. They have a very different perspective, and they really bring a different set of eyes, to the creative that we're doing. So, it's a benefit to not be someone who has kind of been brought up in the healthcare industry. And so certainly don't let that be a deterrent when you're out there looking for a new position. I think we are at 1 o'clock. That time flies when you're having fun.
Sure does.
So this was really a great panel. I really enjoyed, the conversation, and I hope everybody else did. But I guess I'm going to hand it back to AMA New Jersey, or AMA. Thank you.
Thank you very much, Mary. We appreciate it. You guys, the hour went by very fast, so we appreciate all the great insight. I'm going to put a quick poll up and ask everyone here if they could take this quick survey for us. And again, want to thank all of our panelists and thank all of my cohorts from across the country that helped put this together. Esther in New York, Helen in Boston, Steve in Madison, Christine in New Jersey. We appreciate all the work that went in. And Erica, Devin, Stephen, and Mary, we appreciate all your great insights. We had one other panelist who actually got ill today and couldn't make it. And so our thoughts are out with him. Hopefully he's recovering soon. But thank you all very much. And we hope you guys have a great rest of the week.
Bye, everybody.
Hi, thank you.